Hi, my name is Patrilah, and I'll be your studio nurse today. Can you please state your name and your date of birth for me, please?
My name is Viana Luis, September 1951, 9.
Okay, for the purpose of the video and for the purpose of time, we will not be doing the general survey today, so we'll be going straight into the assessment. So the first thing that I will do is inspect. I will inspect the chest wall, and I will check for breathing. I will check for the rate of the breathing, and I will check to see if she's breathing with any muscle use. And so right now she shows no acute respiratory distress. Second, I will begin with the neck and looking for jugular distension, which is a sign for chronic congestive heart failure. So I will begin by inspecting. And inspecting, you would notice the vein would be popped out, which is a sign of congestive heart failure. So if it looks smooth and the vein does not pop out, that means there is no sign of congestive heart failure. So now I will begin to auscultate not with the diaphragm, but with the bell at the angle of the jaw, so which is right here. And I will only push slightly so it doesn't give me any false sounds. Okay, and I will also listen at the base of the neck. And I'll repeat that on both sides. So at the angle of the jaw, and at the base of the neck. Okay. And there's no sounds. Everything is normal. And now I will palpate on the lower middle groove. So right in between here, in the lower middle part, I'll palpate. And I will repeat that on the other side also. The lower middle groove, right in front, in between the carotid artery. Okay? And everything seems normal, so there's no sign of congestive heart failure. Now, what I will do next is palpate the chest for any subcutaneous air trappings. So I will palpate the chest right here. Okay. And right here, when I'm palpating, I'm checking for any subcutaneous air trappings. Okay. And everything seems good. Next, I will auscultate lung fields. So, and I will begin at the top left side. And I will listen with the diaphragm. Okay. Can you breathe in for me? Okay. Breathe in and out for me. Okay. Breathe in and out for me. Okay. Breathe in and out for me. Okay. Now, because of the video and it's being recorded, if this wasn't being recorded, because if there is more breast tissue than other women, I would ask the patient to lift their breast tissue, and then I will then auscultate under the breast tissue to get to the other sites of the lung. Now I will also do that to the back, and I will inspect the back, and then I will percuss with my non-dominant hand and my middle finger, and I will hit the middle of my finger with my dominant hand. And I will do that on the back part. So, stand up. Let me show you guys. Turn around. Okay. So let me adjust this for you guys. Okay, so I would do that. I would put my, so do it below the ribs and not on the ribs, so you don't get the wrong sound. So take the non-dominant hand and put the middle finger and just percuss. And just percuss it with your other finger. And just tap it twice. And you would repeat on the other side. Okay, you can sit. And I'll just adjust the camera. No, sit, Grandma. Okay. So then, I would just go in the back and auscultate in those same sounds, starting at the top and listening on one side, then going on the other side and going down, other side, and so on. Then after that, I will identify the anatomic areas and identify S1 and S2. And I will begin to osculate that with the aortic being on the right side. So the aortic would be locating the aortic. You would go to the sternal notch and go down 2 and to the right. And listen. Right here at the aortic point, which is where S2 would be heard the loudest, which is in the second intercostal space. And right across from that is the pulmonic, which you will also hear S2, and that's also the second intercostal space. And right below would be, slightly below the pulmonic, would be Erb's point, which is where you would be able to hear slightly both of S1 and S2, which is in the third intercostal space. And so on. Because of the video, we're not able to go fully directly because of her shirt and the way everything is. So I will just imitate it for you guys and not like actually do it. So right below the Erb's point, you would go slightly this way, and then that would be the tricuspid, which is where you would hear S1 the loudest, and which is also the fourth intercostal space. And right below that, slightly below, is the bottom of the heart, which is called the mitral, which is where you would hear the S1, and it's also the fifth intercostal space, and it would also be where the mitral, which is also called the point of maximal impulse. Okay, and then that would conclude the examination. Thank you. Do you have any questions?
No.
Okay.